In 2010, just 37 Ohioans were diagnosed with Lyme disease. This year, it is nearly 1,800, a 47-fold spike that has blindsided doctors and families across the state. Ticks are now active almost every month, spreading disease in backyards as well as in the deep woods. How did Ohio transform into a national hotspot so quickly? The personal toll is only beginning, as you will soon see. A single step on the Buckeye Trail can change everything. For one hiker, the warning signs came quietly. She did not spot the tick. No bite, no rash, just a long, sunlit afternoon deep in the Hocking Hills, where the woods pressed close and the trail wound between mossy stones. Days later, a wave of fatigue hit hard, stronger than any post-hike soreness. By the end of the week, simple chores left her breathless. Sleep brought no relief. Doctors ran tests for anemia, thyroid, even depression. The answer stayed hidden, just like the tick that slipped beneath her sock and fed unnoticed for hours. Weeks turned into months. Joint pain flared, then faded, then flared again. Her calendar filled with appointments, family physician, then rheumatologist, then infectious disease. Blood work offered few clues. Each negative result brought more questions. The outdoors, once a sanctuary, now felt risky. She replayed every mile in her mind, searching for a moment she might have brushed against tall grass or leaned against a fallen log. The diagnosis, Lyme disease, came almost 4 months after her hike. By then, the infection had settled deep. Antibiotics helped, but the exhaustion lingered. Some days, she struggled to finish a short walk around her block. She wondered how many others had missed the moment it all began. For hikers across Ohio, the risk is silent and constant. Ticks cling to low branches and leaf litter, waiting for a passing host. The Buckeye Trail, stretching over 1,400 miles, draws thousands each year into landscapes now teeming with black-legged and lone star ticks. Most bites go unnoticed. In high-prevalence counties, more than half of tested ticks carry disease. The wilderness offers beauty and an invisible threat that can follow you home long after the boots are off. On a quiet Saturday in May 2024, the Reynolds family's backyard in suburban Columbus looked like any other. Freshly mowed grass, a swing set, a few scattered toys. 8-year-old Ethan darted barefoot across the lawn, chasing his younger sister. His mother, Lisa, called him in for lunch. That is when she spotted it, a tiny dark speck clinging just below his knee. At first she thought it was a bit of mud, but it would not brush off. Closer inspection revealed the legs, the hard shell, a tick, already latched on. Lisa removed it carefully with tweezers and saved the tick in a plastic bag, just in case. She had not planned for a doctor visit that day, but the pediatrician's office squeezed them in. The nurse asked about camping trips, hikes, pets. Lisa shook her head. No woods, no recent travels, just their backyard and the local park. The doctor prescribed a short course of antibiotics as a precaution, but the uncertainty lingered. Would that be enough? What if symptoms appeared weeks later, like they had for others she had read about online? A few days later, the insurance denial arrived. The tick test was not covered. The recommended lab was out of state, and the bill for expedited analysis topped $200. Lisa filed an appeal, but the process dragged on. Meanwhile, she watched Ethan for fevers, rashes, complaints of joint pain. Every mosquito bite, every headache set her on edge. The family's sense of safety in their own yard had changed overnight. Stories like the Reynolds are no longer rare. Recent years have brought ticks into playgrounds, patios, even city green spaces. In Franklin County and its suburbs, reported tick encounters have spiked alongside statewide Lyme disease cases, which soared from 37 in 2010 to nearly 1,800 in 2024. For families, the cost is not just medical, it is the constant vigilance, the insurance battles, and the uneasy feeling that nowhere is truly safe anymore. In Vinton County, a nurse named Carla starts her summer shift already behind. The waiting room at the local clinic fills early. Toddlers with fevers, farmers with rashes, a middle-aged woman who cannot shake weeks of headaches and joint pain. Tick season used to mean a few cases of Rocky Mountain spotted fever or the odd rash. Now, it is a daily scramble to keep up. The phones ring non-stop with parents asking about swelling, about a bite that was not there yesterday, about antibiotics and insurance codes. Carla checks her schedule. Every slot is double booked, with some patients waiting hours just to be seen. The clinic's only rapid Lyme test is out of stock, and the nearest hospital lab is 40 minutes away. She jots notes for the doctor, possible Lyme, but knows the blood work might come back negative, just like last week. There is no time to explain the limits of early testing to every worried family. Some drive in from 2 counties over because their own health department does not have the staff or supplies. By noon, the stack of paperwork grows. Insurance forms for tick testing pile up, some marked denied or pending. The clinic's tick information handouts are gone by lunch. Carla tries to reassure an older man whose fever has spiked, but she is already thinking about the next patient, a teenager with a swollen knee and no obvious bite. This is the new normal in parts of Appalachian Ohio. The surge in cases has outpaced resources, leaving rural clinics stretched thin. Nurses like Carla are the first line of defense, but the tools at hand often fall short. Each day brings more questions than answers, and the line at the door never seems to get any shorter. Ohio's forests have changed in ways few people notice until trouble arrives. After decades of farmland abandonment and conservation programs, wooded areas have rebounded across much of the state. Since 2010, forest cover has grown steadily, especially in Appalachian counties, where tree canopy now blankets more than 70% of the land. But these are not the endless, unbroken forests of old. Instead, what has emerged is a patchwork: small woodlots, strips of trees along creeks, and tangled borders pressed tight against new subdivisions. These fragmented edges, where lawns meet brush, where playgrounds back up to thickets, are where deer thrive. White-tailed deer, once nearly wiped out in Ohio, now number 725,000 statewide. In places like Vinton and Guernsey counties, surveys have counted over 100 deer per square mile, far above what the land can support without damage. These animals are drawn to the same spaces people use: the margins of parks, the wooded corners behind schools, the greenways threading through neighborhoods. Here they find both shelter and food, grazing on gardens and shrubs, bedding down in the shadows just beyond the fence line. For ticks, deer are the ultimate vehicle. Adult black-legged ticks feed and mate on deer, hitching rides as the herds wander from forest to backyard. The more deer, the more ticks. Each doe or buck is a moving platform, dropping engorged females into the leaf litter where thousands of eggs will hatch. Researchers at Ohio State University point to this relationship as a driving force behind the tick surge. As deer populations climb and forests fragment, the boundary between wild and domestic blurs. Ticks do not stay deep in the woods. They ride the edges, following deer into the places where people live, work, and play. Biologists call this the edge effect. Every new strip of woods bordering a yard, every thicket along a bike trail, increases the risky overlap between humans and ticks. In Ohio's reforested landscape, these edges are everywhere. The result is a landscape that invites both wildlife and the parasites they carry into daily life. With deer so abundant and forest edges multiplying, the conditions for tick encounters are set long before anyone steps outside. The silent spread is not limited to rural counties either. Suburban and even urban neighborhoods now sit at the front lines as the ecology of the state quietly shifts underfoot. On a humid morning in July 2020, a routine livestock check on a Gallia County farm turned up something Ohio had never officially recorded before. A single tick, barely the size of a sesame seed, was sent off for lab analysis. Within days, entomologists confirmed the first Asian longhorned tick in the state. By the time the news reached public health officials, the tick's presence was no longer isolated. It had already spread, quietly, to at least 19 counties along the Ohio River and deep into central Ohio. Unlike Ohio's native ticks, the Asian longhorned tick brings a new set of challenges. It reproduces almost entirely through parthenogenesis, A single female can lay thousands of eggs without mating. Dr. Risa Pesapane at Ohio State says you only need one female to start an infestation. There is no need for a mate and no slow build-up. Populations can explode in a single season, overwhelming pastures and fields before anyone notices. This tick is not just a livestock threat, it is a biological wildcard. In other states, Asian longhorned ticks have drained enough blood from calves and sheep to cause fatal anemia. In Ohio, farmers now check their animals for unexplained weakness or sudden deaths, aware that a single overlooked tick could mean disaster for an entire herd. The species-level danger does not end with reproduction. The Asian longhorned tick is uniquely adapted to Ohio's changing climate. Most ticks slow down or disappear when temperatures drop. Not this one. As long as the air stays above 38 to 40 degrees Fahrenheit, it remains active, questing on winter days, clinging to snow-covered grass, waiting for a warm-blooded host. The old boundaries of tick season have vanished. In recent winters, field researchers have found questing ticks in January when the ground should be frozen and the woods silent. What is more, the Asian longhorned tick's arrival exposes cracks in Ohio's surveillance system. Official confirmation lagged behind its actual spread, with cases likely missed for months or even years. The tick's ability to multiply in isolation and survive in cold weather makes it nearly impossible to contain once established. Each new county confirmation is a reminder that the rules have changed, and Ohio's tick problem is now year-round and fast-moving, one that few outside the scientific community saw coming. Official numbers tell only part of Ohio's tick story. Behind every chart and county map is a tangle of missing data, lost in the handoff between busy clinics and state databases. In a small office above the courthouse in Perry County, IT coordinator Mark Evans spends his mornings troubleshooting the Ohio Disease Reporting System, ODRS. The system is supposed to make reporting tick-borne diseases quick and seamless. In practice, it's a maze of passwords, dropped connections, and forms that time out if a nurse steps away for more than a minute. Some days, the only way to submit a case is by fax if the internet holds up. Clinicians face a 24-hour window to report every suspected tick-borne illness, but with waiting rooms packed and only a handful of staff, that deadline slips. Paperwork piles up next to lab results that may not come back for days, sometimes weeks. In rural clinics, a single positive Lyme test can trigger hours of follow-up, phone calls to the patient, the lab, the county health department, and finally, the state. Each step is a chance for cases to fall through the cracks. The numbers look clean on the state's dashboard, but the reality is more underreported. National estimates say only 1 out of every 8 to 10 tick-borne disease cases in Ohio ever makes it into official records. In Appalachian counties, some years pass with 0 reported cases, even as local clinics treat patients with classic symptoms. Mark shakes his head at the zeros. No way that matches what we see, he says. It's not that the ticks aren't here, it's that the cases don't get counted. Researchers like Dr. Mario Grijalva at Ohio University call the situation worrisome. He points to the undercount as a warning sign, not just a statistical footnote. Each missed report means another family left out of the data, and another community that appears safer on paper than it is in real life. The true scale of Ohio's tick problem stays hidden, not because the danger isn't real, but because the system built to track it is stretched too thin. In a quiet cubicle at the Ohio Department of Health, data analyst Priya Shah scrolls through the latest tick-borne disease reports. Her screen fills with numbers, each cell representing another positive test, another family upended. The graphs climb month after month, pushing past every previous high. When Priya runs her projections, the curve bends sharply upward. Lyme disease cases, anaplasmosis, ehrlichiosis, all follow the same relentless path. She flags the pattern in her weekly summary, but the response from above is muted. Funding this year, once again, favors mosquito surveillance and West Nile prevention. Ticks, she is told, remain a secondary vector priority. Priya's models suggest something different. If current trends hold, the number of Ohioans seeking emergency room care for tick bites could soon overwhelm local hospitals. Her calculations point to a possible doubling of emergency room visits by 2027, even as official tallies lag behind the reality on the ground. She includes a warning in her report. Tick-borne disease cases are accelerating at a rate that outpaces public awareness and state response. But budgets are set months in advance, and tick control programs compete with other public health crises for limited dollars. Priya watches as proposals for expanded tick testing and public outreach get trimmed or tabled in committee. The state's main tick surveillance grant is a fraction of what is allocated for mosquito abatement. Meanwhile, the emails keep coming in from county health departments, requests for updated tick maps, questions about new species, pleas for more rapid test kits. Each message carries the same undertone. We are falling behind. The conflict is not just about resources, it is about perception. Mosquitoes have long dominated the conversation, their threat tied to high-profile outbreaks like West Nile and Zika. Ticks, by contrast, spread their danger quietly, case by case, across the state. Priya's data shows the gap between official numbers and actual risk is widening. Without a shift in priorities, she fears the surge will break through every barrier the system has in place. The warning signs are all there, hidden in plain sight, waiting for someone to listen. Right now, Ohio's tick season stretches nearly year-round, and new species keep crossing state lines. With cases soaring and underreporting still rampant, the real scope remains hidden in plain sight. Public awareness lags behind the science, leaving more families at risk every season. The next bite could happen anywhere, and the consequences are no longer distant. Stay aware, stay vigilant, and share what you've learned. Let's keep this conversation going below.